Welcome back to the Morning Blend. This incredible photo broke a world record. Get this, all of the people in this skydiving formation are over 60 years old. Our next guest helped set that record thanks in part to his surgeon who replaced his hip. Ray Medley is that skydiver. He is here along with renowned hip and knee replacement surgeon, Dr. Richard Berger. Good morning to you, gentlemen.
Good morning.
Good morning. Thanks for having us.
I'm so pleased to have you joining us this morning. And I got to start with Ray. I got to start with you first. Are you nuts jumping out of a perfectly good airplane?
Well, it's an old military thing, and I really enjoyed it. And it was nice to be able to come back to it.
Yeah, good for you. I think it's incredible, which leads me to my next question. How did you find Dr. Berger, and when did you know that you needed hip replacement surgery?
I found Dr. Berger through a friend of my wife's, and what was interesting is she had told this lady that I was probably going to need a new hip, and she said, "Oh, he'll love it." And the whole thing is like this woman sitting there in high heels, and she was a runner. And my wife looked at her and she goes, "Well, how would you know?" And she goes, "I've had both my hips replaced." And Dr. Berger replaced. And she said, "If you go in an athlete, you'll come out an athlete." And that was my biggest concern in finding a physician that would take care of me and make sure that I could continue to do the things that I enjoyed doing.
I totally respect and appreciate what you're saying about that, especially because you're a marathoner, you a rock climber, skier, martial artist. So you do this skydiving in formation. You're breaking world records. What's your next challenge? How do you top that?
Gonna do another world record in April.
Whoa!
We're gonna make 100 this time. That one was I've been on one that's a 66 way, and then we did a 75 way in Chicago. The one you're looking at there is a 66 way in Paris, California. And then we'll do another one in Paris, California, only this one should be a 100 way.
I'm curious, what's the trickiest part of a formation like that? You're obviously diving with experienced people.
Well, to make sure that it's a well choreographed procedure that we're doing. Everybody going out of the airplane knows exactly where they need to be. They divide up the sky by quadrants, and then they ended up, I would probably say the most dangerous part is actually getting air once the formation's done, getting clean air so that you can open your parachute.
Fascinating. All right, doctor, I got to talk to you. I know you've pioneered this minimally invasive approach to hip and knee replacement. You've done something like 20,000 of these outpatient. You got your degree from MIT. Was that experience and training, schooling you got there important to this discovery, this innovation?
Yes, I think it was. You know, if you really look at what needs to be done, you need to design a whole bunch of instruments, over 200 that I designed to do the surgery, and then a whole new way of thinking about it, which an engineering degree really helps you do. So schooling was really important to developing this new technique. The technique is different because we don't cut muscles, ligaments, and tendons. So not only is the recovery faster, but more importantly, it's more complete. So you can get back to doing everything you want to do as soon as you want to do it.
See, and that was so important to Ray because he didn't want to give up his incredible athletic pursuits. What's also fascinating about your background is some of the other people you've performed surgeries on, and there are hundreds of elite athletes and celebrities. New Orleans Saints quarterback Archie Manning. There was a Chicago Tribune article that said you did this procedure on actor John Slattery of Mad Men, who a lot of people will know. And then President George W. Bush. A lot of people know that he's done some skydiving too.
Well, it's wonderful to be able to operate on celebrities, of course, but mostly we help regular people who maybe want to get back skydiving or running marathons or triathlons, but maybe just want to take their dog around the block for a walk. And that's all important. And the one most important thing we ask patients right away, and I heard this in your last segment, was we do this so people can get back to what they love. The first question we ask them is, Why are you doing this? What can we get you back doing? And sometimes it's marathon running or skydiving or getting back to acting or professional athletics, but sometimes it's just playing with your grandkids, getting on the floor and playing with your grandkids, going downstairs to do the laundry, or taking your dog for a walk around the block.
See, I love that it's not just celebrities and elite athletes, because people watching today are going to say, hey, I want that doctor to look at my knee or my hip. Do you do telehealth visits? And I'm also wondering where you perform these surgeries, because I know that you have an office in Chicago.
So we do telehealth visits. Right now, about half the patients I operate on and see take an airplane to come see me. But a lot of the patients, whether they live locally or far away, do it via telehealth. So we see them, we look at their x-rays, we talk to them, we get to know them and see if they want to come to see us, if it's a right fit. And that we do in the privacy of your home. So we do it via telehealth. No matter where they live, it just makes it easier. Now we operate in Pleasant Prairie up in Wisconsin, surgery center in Indiana, and Rush Hospital in Chicago, as well as another surgery center in Oak Brook, Illinois. So we try to go to where the patients are. We try to make it easy for patients to come from wherever they are. And what we'll do is we'll see them via telehealth, decide what needs to be done. They come in, they have their surgery, they fly back to wherever they're going to fly to the next day or two, and then we see them and follow up via telehealth. So it really is easy.
And then they're ready to jump out of an airplane, right?
They're able to do anything that they want to do, get back running, skiing, jumping out of airplanes, whatever they want to do. That's what the goal of the surgery is to get them off their couch, out of pain, to alleviate their pain and restore their function to do whatever they want.
Wonderful. Doctor, thank you so much for your time. And Ray, good luck to you in your next pursuit.
Thank you very much. I appreciate it.
Great to see you.
And thank you, Dr. Berger.
Yeah.
I have a
My
life
pleasure.
Thank you both so much for your time. And you can make an appointment with Dr. Berger by calling 312-432-2557 or log on to the website outpatienthipandknee.com. He performs his surgeries at North Shore Surgical Suites in Pleasant Prairie.